Okay, great. We're going to go ahead and get started. A few more folks may still be joining us. Good morning. Thank you for joining us for the session, Active Ingredients of Early Interventions for Social Communication and Autism Spectrum Disorder. We're looking forward to a great session today. A few logistical notes as we begin. You're going to hear these several times throughout the course of the day. This session is being recorded and the chat is being archived. Attendees are in view only mode to keep things orderly, so you cannot use your microphone. But we encourage you to use the chat box throughout the session to engage with the group or to raise any questions for Dr. Edmunds. We can either get into those as we go or save those for Q&A at the end. You can also post here for any technical issues that you experience and any questions that you want our presenter to weigh in on. The session has auto captioning available. They're not exact, but they do go a long way to improve accessibility for attendees. To activate these as a viewer, you can look for the option on your toolbar that says live transcript and select either subtitles or full transcript, which will appear in a sidebar. The options may be different on a mobile device. They're actually quite good for an automated software, so we do recommend them. A recording of the session will be made available on our YouTube page, and we'll share that with attendees. A quick note on professional development credits. If you're intending to claim professional development credit through the SC Endeavors program for early educators, please complete the submission form that I will share in the chat box shortly. This is essential to us having the information that we need to process your credits, and you must attend the session for the full duration to receive credit. Sessions are also eligible for CMEs for medical providers. Further information, including the link to complete your attestation form, will be sent in a follow-up email very soon. For other CME professionals, ICS is happy to provide verification of attendance for your governing board if they accept that. You can reach out to somebody in the lobby. You'll get directed to John to help process that. At this time, I am pleased to introduce our presenter for this session, Dr. Sarah Edwards. She is assistant professor at the University of South Carolina with the Community-Oriented Lab for Autism and Behavioral Interventions. Dr. Edmunds, take it away.
Thank you so much, Megan. Now that I've unmuted myself, I just want to welcome and thank all of you for coming today. It's nice to see a few familiar names in the participant list, and I'm excited to talk to you all today about what we know about not just active or effective intervention packages, but also just effective active ingredients or individual strategies that we know enhance early social communication development for all children in that crucial birth to 3 stage, but also children who have or may go on to be diagnosed with autism. So just to start, I would appreciate if you all would put something brief in the chat for me so I know who my audience is a little bit more. If you could just put your kind of job role or personal role, so parent or early interventionist or physician or anything in a few words you feel like describes your perspective coming into this for me. Okay, great. Hi. So just scanning as these come in, thank you. I see we have people coming from a lot of different professional training backgrounds, a few parents. We've got people from BabyNet, which is excellent, and a lot of trainees as well. And I look forward to talking with you all, and I really open it up to any questions that you have, because I know people are coming at this area with differing levels of expertise and experience. Okay, so my learning goals and an overview for this talk is that by the end of this presentation, you'll have a greater understanding of behavioral and developmental perspectives and how they are essential for high quality evidence-based social communication support or intervention for young children. I also want to share with you about a evidence-based large set or group of interventions or supports that are increasingly being implemented in birth to 3 and even preschool and other systems in the country called NDBIs, Naturalistic Developmental Behavioral Interventions. I'll also share with you the limited research thus far and some of the clinical expertise or clinical insight on what we think are the real active ingredients of these interventions, little core nuggets or strategies that you can pull out in your own practice or with your own child. And then I'll end with, I have some examples of how you might pull out some of these core or active NDBI strategies to use at home or in your professional setting when home visiting or in the clinic. Okay, some of this just to set the stage. As you all know, in the first 5 years of life, it's a period of great growth, learning, and brain plasticity in which children develop rapidly in all domains, right? This probably should be more of a cone than a line because there's also so much variability in development at this young age. And in these first 5 years of life, development kind of cascades over time. So one skill learned in one domain, like an attention or motor domain, might then unlock or help children grow skills in other domains, kind of cascade through their other aspects of their development, like their language development, their social development, their cognitive development. And all of these domains kind of interweave and inform and help children build skills in all the others as they grow. And understanding this is really kind of crucial for understanding how we help children grow in their first 5 years. And then in the first 5 years of life too, children start to learn through contingencies in their environment. So they start to learn, as you all are familiar, if I do this, then this happens. A classic example is, when a child is young and it's snack time and they're maybe in a high chair and they realize if they throw like a spoon off the high chair, it makes a fun noise on the ground. If I do this, then this happens. And then they start to learn if I throw a spoon or food off the side, it's a fun noise, but it's also my caregiver might come over and, say, hey, what's going on? And that's also a fun contingency or thing that happens. So the children's environment really shapes what they start to learn about their own abilities and their world. And, especially for this conference, but anytime I talk about development, I really try to talk about how families are so crucial. They are children's most immediate support systems, and there are broader ones that we'll talk about. And they really are the ones that are supporting children's development. But so are systems of care, right? So in addition, for all children, by age 3, 4, 5, they may be accessing some sort of preschool or kindergarten, right? And then that additional system of care becomes important for them. But also important to note, in this period of time, many children have delayed development in various domains, motor, attention, cognitive, and that's part of what BabyNet and other birth to 3 systems are for, to support children in those early delays to try to help them grow to their greatest extent in this period of such brain plasticity. And I want to focus on a particular type of delay that children can have as early as kind of age 1.5 to 2, which is delay in social communication ability. I'll talk a little more about that. So zooming into this delay, social communication is defined as any type of communication behavior like words or vocalizations or babbling, gestures, eye gaze, facial expressions, play actions even, that are for the purpose of interacting with others. And that can be to share their needs. I need a snack, or I want this toy, to share interest. I really love that cool airplane in the sky. Look, mom, look at that. To learn from others. So, that an adult showing a child how to play with a new toy, or how to, what the label for another toy or object is. And then also just to feel close and form relationships. And it's important to note that social communication challenges are a core feature of autism spectrum disorder when combined with other criteria. They're often one of the earlier concerns that parents and clinicians have, especially for children in the first 3 years of life, but of course, beyond that as well. And I think also, and I'd be curious to hear what my BabyNet colleagues and others who are really working closely with birth to 3, but my clinical experience is also that social communication delays can be common in children with broader developmental delays, or who may not go on to be diagnosed with autism. So they're an important area to think about how we intervene on and how we support. And so I had the original circles around, the 4 to 5 daycare preschool that most all children start to access. But really, extra support for families is even more important when children have delays, especially delays in things like social communication. And so you might see birth to 3 or other home visiting programs start to help families and their children in the first 3 years. And then you might see maybe some earlier access to daycare and preschool with more specialized supports, even in the earliest years. And so then what are the evidence-based strategies that support social communication growth specifically? And really thinking about this in family settings and in settings where additional support systems assist families. And so what I'm going to talk to you about is, I'm going to talk to you about a group of interventions called naturalistic developmental behavioral interventions, and many different things fall into this. And just to define them based on what I've just shared, these interventions are behavioral in the sense that they harness or take advantage of the fact that all children are kind of learning through contingencies in their world. If I do this, then this happens. They're developmental in the sense that they really help parents and us understand child development in all those different domains, and how we can maybe work on one little skill like imitation, and how it can help have kind of a cascading or broad effect on other domains of development. And they really also focus on really responsive, warm interactions as the context for intervention. And then lastly, they're naturalistic. And that's perfect for a group like this that is really considering how we strengthen families in the context of their child's development. And these are interventions that are designed to be in home or family, daycare, or preschool settings. Although there's definitely work we need to do to make sure that some of these interventions are really easy to implement, possible to implement in some of the school-based settings. And I'm happy to talk about that later. Okay. And I think it's important to understand, at least I was very interested when I learned all of this, to understand what the history is behind intervening for social communication and broadly for autism. And often these early interventions for autism, their main outcome they're interested in helping children grow in is social communication, as opposed to the kind of the broader other criteria of autism, just because social communication is so crucial for other development. So there originally, there was a behavioral camp kind of on one side of the debate that, and then there was a developmental camp on the other side of the debate, and they each had different thoughts about how children learn, and they viewed themselves at odds with each other in the beginning. So, some of you might kind of term the behavioral camp applied behavior analysis, or ABA, which is really just the application of behavioral science to help people. There's lots of different types of ABA. There's lots of different ways to use behavioral principles and approaches, but I put that there as a shorthand just to orient you. Happy to talk about the nuances. But when the behaviorism first became a clinical tool, people like Ivar Lovaas were trying to apply it, as well as others, to help modify children's behavior, help them follow instructions, help them acquire skills, really thinking about how do we help children show us the skills that we want to see. And then the developmental camp really felt like child learning was facilitated primarily through creating a very rich social, affective environment in which the child could be engaged. And you'll see here, these are also traditional developmental only interventions for social communication, such as DIR, floor time, and CERTs. And so these two groups, I think, have traditionally kind of been at odds with each other in a way that I'm going to try to argue for you doesn't really make sense, and we can kind of take the best from both of them as is appropriate for each child. Okay, so many of you might know this, but I just want to orient at its core, a behavioral approach to understanding how children learn is by thinking about kind of the structure. So I think about it as the ABCs of behavior. A is antecedent, B is behavior, and then C is consequence, but sometimes we use the word response because we don't mean consequence in a punishing or punitive way. We actually almost always mean consequence in a rewarding, reinforcing way. And we always try to make that the case. And so, an example of kind of breaking down this structure of how children learn is this. Perhaps it's snack time at a preschool, and the teacher is there with the snack, holding out the snack, ready to serve it to the child. That's the setting and the cue for the child to communicate that they would like snack. And they might do that in a variety of ways, show us that they want snack. They might reach for it. They might use a word of the food. They might look at you and smile expectantly and then look down at their plate and look at you and look down at their plate and look at you, right? All of those are ways of showing, I would like snack, please. And then the natural response is that the child receives the snack, enjoys it, and that the adult next to them is excited and happy that they've requested and is spending time with them. And so this is an example of those contingencies I talked about. If I do this, the child will learn. If I do this in this situation, then this happens. And any behavior that a child uses is communicating a need or having a function. But often children who have social communication delays or who might go on to have a diagnosis of autism don't have some of those behaviors developing in a natural or like a typical kind of way. So they may not be able to initiate joint attention with you and look up at their plate and their food, or they may not automatically point or reach or have a word. And so the idea would be that we want to teach children skills to meet those needs. And then starting to bring the behavioral approach into a developmental approach, I want to point out here that in this structure of how children learn, this is what the child can control, what they do in the moment. And this is what we influence as the child's family, providers, environment. We influence what the setting is for the child and what kind of cues or things we want them to do. And then we influence what happens afterwards. We influence how we encourage and support and reward a child for their attempts to engage with us and show us their skills. And so you can think of this as kind of a supportive structure, supportive environment around child growth. And just so, the kind of behavioral approach developed in the 70s and 80s when people unfortunately had the thought that autistic children or children with social communication delays just couldn't learn, and so was very revolutionary in its own way, but was often being implemented in a way that isn't appropriate for young children. This structure, maybe it was all at the table or it was all over and over and over again, and that's just not appropriate for how toddlers and young children learn naturally. And so the developmental approach really added and reminded everyone who was invested in supporting young, potentially autistic children or children with delays that naturalistic settings are important and social engagement is important. And, a lot of excellent research started to come out around this. So, the idea that children's learning, all children, is enhanced when others around them are responsive to what they do, right? That response last piece of the ABC, and that when they're socially engaged with them in places that or in settings that the child is motivated and interested. And then also just a developmental scientist was coming at this same idea of contingencies from a developmental perspective instead of a behavioral one. But, Dr. Gibson back in the 80s was really thinking, okay, children learn by experiencing the effects of their environment on what they do, right? In their everyday environment, not just in a special setting, but around with mom or around in the playroom or at school. And I think also, just to really hit this point home, neither approach is as helpful by itself as they are together. So sometimes, despite sometimes being quite effective and really appropriate for toddlers and young children, developmental only interventions maybe are lacking some oomph in that they don't often think about learning as this kind of structure. Like, I set something up, I help a child show a skill, and then I praise and reinforce and kind of go back to a child's play. They don't necessarily, it's not often implemented in that way. And sometimes not really knowing that can lead to some lack of clarity and maybe just not focusing on growth in the way that we hoped that would be. And just also really thinking really clearly about what really is the skill that I want my child or my student or my client to learn. So, do I want them to learn how to make eye contact with me? Or do I actually want them to learn how to show me they enjoy themselves in a lot of different ways, right? Like by smiling or by doing a wiggle, if that's their way of showing engagement. Maybe that's the skill or behavior I'm trying to encourage the child to show. And then the behavioral camp traditionally lacked an understanding of what the individual child and family brings to intervention. So an understanding of child's developmental stage and how we scaffold a child's skills to just one level up and one level up. An understanding of children's motivation, like what are they interested in doing and playing? Children learn when they're motivated. So we want to follow and not all children are motivated by the same things, right? Especially children who might be on the spectrum. Children's ability to self-regulate and, kind of be in a safe space while they learn, and the role of family in learning. So in terms of what is effective for young children in the first 3 to 5 years who have social communication delays, there's some evidence that developmental only approaches are effective for some children. And there's a lot of evidence that these combined interventions that combine both approaches can be even more powerful. And this is where I'll bring in some name brand names. There are many different, what I call name brand intervention packages that qualify as naturalistic developmental behavioral interventions, or NDBIs. So you may have heard of these. There's pivotal response training. There's the Early Start Denver model. There's JASPER, which stands for Joint Attention, Symbolic Play, Engagement, and Regulation. There's IMPACT, or Project IMPACT. Yes, I'm seeing some familiarity here in what providers use. And that's all about improving parents as communication teachers. there's EMT or enhanced milieu training, there's IT or incidental teaching, and there's actually several more. Name brand intervention packages can be very, very important, but since they all fall under the same category, you won't be surprised when I tell you they all have a lot of common elements that I think we need to learn more about how they work on their own, but also empower clinicians and teachers to use these strategies in their whatever their current setting is. So naturalistic or developmental behavioral interventions, or NDBIs, this is the handbook on them. There's also an article here. Basically, all of these name brand intervention creators came together and decided, you know what, there are a lot of common elements. We can call them by just an umbrella term. And this is what makes them all the same. So they're naturalistic in the sense that they all focus on helping the child in whatever setting is typical for them. So play or home routines like bath time or meal times, the school setting. They all follow the child's lead. This is crucial. So we follow what the child's interested in and utilize the toys and activities that the child is motivated by as settings to teach social communication skills or other skills. And we use what are called natural reinforcers. So going back to an activity the child's engaged in is reinforcing, right? Just to be able to return back to the play, as well as social praise. And I'll talk more about that. These interventions are developmental in the sense that goals are always individualized to a child, just like you all do in BabyNet in your IFSPs, and developmentally appropriate for where the child is. And then you use what's called scaffolding to take a child up, 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 just in little steps as is comfortable and appropriate for them. And leverage that idea of development cascading over different domains, right? Like learning imitation, which is a cognitive ability, might help with some social skills a little later, or learning a motor skill might open up a whole new world for a child if they can kind of move around the world on their own suddenly. And then lastly, they are all behavioral in that the teaching trials have a core ABC format. Like we think about teaching skills that way. What can I set up? What kind of skill am I hoping a child will show, or can I help a child show me? And then how can I really praise and reward the child for that effort? I'll stop here. Well, actually, I'll stop here for any questions kind of at this point in the talk. So I've mentioned this, but NDBIs, there's been many different research studies on the different name brand interventions within NDBIs. And these are two meta-analyses down here that combine all the results. And they've been found effective at improving social communication and also just language ability for children who are 3 to 6+ that's about the height of the stop of the age range with autism, or children who are 14 months to 4 years with just social communication delays, and they may or may not be at higher likelihood of going on to be diagnosed with autism. So I'll stop here and see if anyone has questions so far about how developmental and behavioral principles kind of come together and are the active ingredients in some of the most powerful interventions for young children.
Sarah, this is Megan. I just want to interject to say that we do have a question in the Q&A box.
Great.
Is there any age set for these interventions, or do they work in older children / teens?
So great question. So the research so far has really focused on interventions that they identify themselves as NDBIs because they have developmental principles and naturalistic developmental or behavior, you know what I'm saying, have all the principles and fit the criteria, really only for children about 14 months to 6 years right now. That being said, I think these principles can and are present in other interventions for older children, but we just haven't demonstrated that in the in research yet. if you think about other evidence-based interventions that you use to support older children, like a social skills group, for example, you could probably pick out the pieces of that intervention that are developmentally appropriate in the naturalistic setting for the teen, like practice with their peers, and also maybe behavioral in nature, like let's practice, let's get feedback, let's move on, right? Or like let's kind of approach what might be hard or scary for me. So not by name, like there's no literature out there that says NDBIs as named are effective for children who are older, but I think that's where we're headed, is trying to understand how these could be helpful for older children. Any other questions so far? That was a great question. I'll also point out that this book says for autism spectrum disorder, and that is because there's been this whole set of studies for children who are autistic who've been diagnosed, but there's also been a set of studies for children with just broad social communication delays. And more people are thinking about NDBIs for social communication, not just for autism, even if that's what the book says on the title.
Sarah, we also have a comment in the chat box that says, I wish more SLPs and early intervention therapists knew of these interventions. And that kind of aligns with the question that's been percolating in my head as your moderator / attendee of accessibility and sort of how easy or difficult is it for families who want these services to find them?
Yes. So I actually think I'm going to start going through some of the specific strategies now that are common to all of these name brand interventions. And I would love the clinicians in the room to kind of think about whether they do each of these things already, because to some extent, some of the research shows this, but also just my clinical experience as a clinical psychologist who's worked with birth 3 settings and implemented these interventions before for families. Like, I think clinicians are already doing some of these things. And I think that even if a system can't or doesn't want to get trained on a package, that some of the individual strategies are very helpful and maybe some things you already do. So I mentioned that all NDBIs have kind of that core ABC format, or I'd put response here instead, A, B, R. But NDBIs really is different, way different than what families might be imagining when they imagine ABA or behavioral challenges. I'm seeing a question, are interventions? Yeah, no, I agree, Christina, to the idea that like trying to learn a package is not very quick or financially feasible. And it isn't it probably isn't the best way that we can actually start to really implement these evidence-based strategies, NDBI strategies in community settings. And that's what my research is all about, is about how to implement these in a way that really fits the BabyNet system or other systems and families. And then there's a question, are interventionists typically providing a hybrid intervention of a specific modality? I'm not sure I understand what the question means. I'm wondering maybe, Barbara, if you could reword it, but basically, early interventionists have, kind of their own way of providing a variety of strategies to support the goals that the families the goals are really family driven. But please, I would be happy to respond to the question when you reword it. And I think I know what you're talking about, but I don't want to put words in your mouth. So the main way that at a big picture level, when you ask the question, what does an NDBI look like? What would I see as a parent or as a professional? What would I see happening in a session or in a time that someone's practicing? And the biggest takeaway is this, that NDBIs, direct teaching opportunities, when they occur, that's these little sequences here of ABC, they are embedded in play. fully embedded in the play, to the extent that it might look like play to a family, a parent who's watching, or another professional who's watching. And so let me take you through, like 3 or 4 minutes, 3 to 5 minutes of what an NDBI session could look like by kind of narrating this visual here. So perhaps this child has social communication delays. He's about 2 or 3. He actually looks a little older than that, but bear with me here. And, he has goals around language and around social communication. And that can include things like being social reciprocity, being able to go back and forth in play or in like songs and games, and imitation. So the ability to model what someone else is doing, both because it's kind of fun and because it helps kids learn. So perhaps, that the first thing would be, the child is, there's a couple toys out in the playroom. There's this ring toy here, and then there's also some blocks or something like that. And the mom here is noticing that the child is gravitating towards the ring toy. So she takes an opportunity to embed a little learning opportunity here. She just kind of takes hold of the ring toy really briefly and holds it up and says rings. And that's the setup, that's the antecedent. And she knows that child can say that word. So that's why she picked it. And the child responds rings or something that fits his developmental level. And she says rings and then brings the rings down, and they just start to play. So they play for a little bit. And, now that he's gotten to play, that's such nice natural reinforcement for requesting the rings. And then a little bit later, they're playing. And mom is thinking, okay, how can I make this even more interactive with him and me? And maybe she's thinking, ooh, this will be a fun game. And she takes the ring and she goes, boop, on the child's head. And that's something that she thinks the child might enjoy. And she does it a few more times. She goes, boop, boop. And she gets the child engaged in it. And if the child's engaged, then she just kind of pauses and she's like, oh, what's next? And then maybe she's just looking for any sort of behavior from the child that they want it to continue. So maybe like, it could be like a little wiggle, or it could be like a head nudge to the ring, or it could be eye contact or a word. It's whatever fits that child's abilities. But that behavior, that like, yes, mom, please continue, would be the behavior that she's looking for. And then the response is to continue, because that's what is natural in the moment, and maybe some praise there. And then there's play again, playing with the rings. Maybe dad comes in. And at that point, dad is like, okay, let me show him another fun way of playing with the toy. Maybe see if he thinks that's fun. And maybe he'll pause, he'll take the rings really quick, and he'll roll one instead of throwing it. He'll roll it and pause and give the child a ring. And that's the antecedent for that part. And we'll see if the child rolls it. Maybe he'll demonstrate again, roll and pause. And maybe the child gets it right away, or maybe, you need to show the child a little bit. So you might kind of like help the child roll the ring. And then you'd be like, yay, you rolled it. And that praise, and then going back to the play is the response. So that could be a couple minutes of play, and you've already had 3 opportunities to help a child practice their language and social communication. Okay. I think I can answer that question, Megan and Barbara, in a second. So I know I'm repeating myself a little here because you've heard me demonstrate these things in my example, but I'll break it down here. So in NDBIs, there's additional pieces. So the first thing is called environmental arrangement, where you set up a play space so that it feels appropriate and for a child's learning and focus. Then you follow the child's lead to what they're interested in. And you kind of try to get something called shared control, which is most of the time the child's in control, the child's in the lead, or we're following their lead. But sometimes you kind of take the items just briefly in a playful way. And that is, you have control in that moment so that you can present an opportunity for a child to show a skill. Then, instead of using, other types of reinforcement that are maybe more traditional or old school ABA, it's always natural reinforcement paired with praise. So natural being going back to what the child was doing afterwards. And then a core feature of NDBIs is this idea of animation, making this a fun, socially engaged session or a play session with positive affect, with child-directed speech and a game-like atmosphere. And you can modulate this animation based on the child you're working with. I've known plenty of toddlers who, I'm thinking of toddlers who are autistic, who are on the spectrum, who do not like loud noises, but you can be animated in a more of a quiet way as well, or a way that the child enjoys. And that NDBIs always occur during play, or that stars for whatever is an appropriate setting for them. And then NDBIs are often parent implemented, both because it helps the intervention occur in a more naturalistic context, but also because to some extent, these interventions were being developed at a time where there was a huge kind of a crisis, and there still is, around giving children who are on the spectrum enough intervention hours, coming from the kind of older recommendation that a child needs 40, and now it's more like 25. And so we thought, like parent implemented could be great, because then a child could get support even when I'm not there. And that's also the basis of the EI model as well, like the birth to 3 model. And it can be stressful for parents to be their child's kind of quote unquote interventionist in this way. So I'm happy to talk about that too. Okay, so we're talking about active ingredients here, which means that within the NDBI, are there specific parts of these interventions, specific strategies that are really powerful, that are kind of explain how or why children's social communication improves. And so we see, and I see 2 excellent questions in the chat, and I'm going to respond to them right after this, this next slide. So NDBIs are effective for social communication because it helps caregivers use strategies more often at home, because it helps caregivers start to respond more contingently or more kind of immediately to any sort of attempt a child is making to interact socially or communicate. Sometimes it can help caregivers notice maybe an unusual way that a child wants to communicate. So, sometimes a child will show you what they want by just nudging a toy in your direction, or by looking at it and vocalizing in a frustrated way. Parents might notice that's what my child can use right now to communicate, so I'm going to respond to that and try to help them grow. Helps caregivers kind of pace and mirror their child and follow their child's lead a little bit more. There's also research to suggest that NDBIs work because there's so many opportunities to practice imitation. And imitation is what's called a pivotal social skill that helps improve a lot of other developmental abilities. And then also, just because NDBIs are by their nature kind of encouraging children to try to intentionally communicate with you, even if it's not with a nice, pretty word. Any sort of act that's trying to get an adult's attention is something that is really noticed and responded to and scaffolded in an NDBI. So to Barbara's question, I'm going to answer that in just a second. And then to Zoe's question. Yeah. Okay. So the question, go ahead.
I can just read that question for folks who might not have the chat open. Essentially, with the question of acting early is always key. However, we're aware that several kiddos in the past year due to COVID have gone unidentified. How can we as professionals help get this information to parents if they are past the early intervention window without flooding the child finder education system or are awaiting a diagnosis or further testing. I think this also, Sarah, might align with the question that was asked in the Q&A window, which is related to how NBDIs might align with parent training.
Yes. Okay. Oh, I'm so sorry. There's a weekly alert system test at USC here. If you can hear that out the window, that's what that is. Okay, so yes, it is in general, there are probably many children going through the birth to 3 system before and even more now during COVID who have social communication delays, and you or the parent might be concerned about autism, and they're either parents are hesitant, understandably, to start that process, or they're on the wait list and there's a long wait list. These strategies are things that you can model for the parent, or in the context of parent training, which is really a format that informs and all the parent implemented NDBIs. It's all from this parent training format, perspective of how can we empower families in the moment, coach families in specific skills that they can then use. So I'm going to show you all of the core strategies, and I want you to think about the ones that would be easiest and most natural to include in your practice, or that you already do. And maybe you would up the intensity of those strategies or emphasize them for the family while they're waiting. That is my current, that's my actionable advice on how to support families if they're waiting. There's a lot more that can and needs to be done with our diagnostic pipeline and insurance coverage for additional hours of autism specific services, or even whether ABA agencies are offering NDBI style sort of support that I know we can talk about more.
Sarah, before we go on, I also just wanted to say we do have one question about any videos that you would recommend for folks who are looking to see this model in action. Yes. Is that something that you link to at the end, or if you give me some names, I could pull some links while you're speaking?
Yes, so I will link to a couple of different video resources at the end, but I think also I will think about that a little more and send some to you. I think we don't really have a lot of publicly available video because some of these interventions are brand name, right? And they control their content, but I'm working on trying to create some more accessible video that demonstrates these strategies in maybe a more compelling way than my, where did it go? My little picture that I, go there, this one, the videos of this kind of style might be even more helpful for you or for family members. And I'll link to a few and add a few for you.
Well, and I think your one woman reenactment was wonderful. But I think something that folks can bookmark seems very of interest. Thank you.
Yeah, exactly. Okay, so first core strategy, be face-to-face and on the child's level. 2, follow the child's lead in what they want to play with. 3, imitate the child as part of the way that you play with them. 4, display positive affect and animation while you engage with the child. I know almost all of you, if not all of you, do this. 5, model appropriate language. So as you're playing, use words or phrases that are what we would call one level up from wherever the child's current language level is. If they're using vocalizations, use single words. If they're using single words, use 2-word phrases. So they say car, or you're just playing with cars and you say blue car or big car, right? And so on from there. 6, respond to any sort of attempts to communicate, even if it doesn't look like you'd like it to look, even if it's, as long as it's safe and as long as it's not harming anyone. Even an attempt to communicate that you wish they would do better, right? Or you wish they wouldn't headbutt you to communicate with you. You might first respond and then immediately show a different way of communicating, or go ahead and take that child over to play. Use communicative temptations. I'm going to demonstrate this in a second. It's one of my favorite strategies that I think can be included. And then when you do those direct teaching opportunities, right, where you set something up and you ask for a skill and then you reinforce, try to pace it in a way that feels natural for the child and isn't too stressful for them. So embedding it with play in the right way for that child. Try to make sure you're really clear when you demonstrate or ask the child to do something with your behavior, like holding it up and asking, want snack, or waiting after pausing in a game and saying, and maybe modeling what the child can do to keep going in the game. Make sure it's motivating and relevant so that you're playing with stuff that you're kind of modeling a fun game-like thing that the child can do. This takes a lot of creativity. And then try to prompt the child if they're not getting what you want them to show you or what you are hoping for them to practice. Just help them practice it so that they don't feel frustrated. And then, of course, providing that contingent, natural, and social reinforcement anytime a child tries to do things that you are hoping to see. And this is what I wanted to say, is that while we are researchers and you all are thinking about ways we can systematically offer NDBIs to more children in more systems, in the meantime, we can incorporate these strategies into our existing care. And I'll show you ways to do 3, and then I'll stop for questions and give those responses. Just checking the time. So first, I'll show you some examples of being face-to-face and on the child's level, following their lead. Then I'll talk about imitating the child, and then I'll talk about communicative temptations. Okay, so when we think about being face-to-face and on the child's level, I want you to think, and you probably already do, of the child's attention as their spotlight, like a flashlight coming out from where they are focusing. And with a child who has social communication delays, might be autistic, their spotlight might be kind of down a lot more than a child who, in their nonverbal communication, is showing more social awareness. So like looking up to mom, looking over here, looking over here. So you might need to kind of not too close to them if it's invading their space, but just kind of get into their spotlight and noticing that it won't be coming to you as often. So you want to position yourself kind of within it. And, here are 2 examples. This is me, 10 years ago now. This child was really, really interested in the wheels on the car. And my goal was to imitate him in that moment. And so I just kind of put my face in his field of view. He might not have noticed it. He might have just been with the wheels, but at least it was there in his spotlight. And then in terms of following the child's lead, as far as what activities to play, which of the following rooms do you think it would be easier to follow the child's lead in? Okay, here's number 1. Following the child's lead in terms of what they want to play with here. Here's number 2. Yeah, thanks for putting some responses in the chat. Here's number 1. Here's number 2. Now, I think there's some personal preference here, and 2 isn't perfect either. But I picked both of these, especially number 2, because your playroom doesn't need to be perfect and lovely and full of the most expensive fancy toys at all. So the general consensus is that this might be too distracting. Like there's a lot of things to hold a child's or to distract a child, and it might be hard for you to kind of play in a deeper way with a toy long enough for you as the person to think about, oh, how could I practice a skill here? How could I help the child practice a skill here? Because it takes a lot of thinking on your feet. And whereas this one has fewer toys, which might be better for following the child's lead. Even better if you set up a few in advance that you think might be particularly fun or helpful. Now, of course, I know like there's distractors here too, like this random wastebasket could be a safety concern, or these packages, I don't know. So you have to kind of go with the child that you are working with, that you know, in terms of what might be easiest for them. I already kind of said all of this and emphasized that toys do not need to be fancy. I've done a lot of good NDBI style intervention with paper towel holders or like paper towel tubes and like lids from a kitchen, anything that holds a child's interest. It is easier to use toys that aren't electronic, but I have strategies for incorporating like electronic toys into intervention. And then imitating the child. So really just doing whatever they're doing with a toy. It helps if you have a similar toy, like not perfect doubles of everything, but just like similar types of toys here. You know, she picked up a different block. And it can be any behavior that isn't unsafe or that you don't want to see. Of course, we don't want you to imitate things that are dangerous. And then this one. So communicative temptations are very fun, and you want to know the child to know what they are like and what they're motivated by. But you can use things like preferred toys and snacks to tempt requesting. So let me do another one-woman narration of you from a video I'm thinking of that I didn't have permission to use. But in Project Impact, which is one of the package NDBIs, one of the training videos, the clinician puts the bubbles up on a high shelf and has the child and models for the child, come here, because she was working on that come here gesture. That's what she wanted the child to imitate. And the child was very motivated because saw the bubbles, and the clinician is showing him how to get the bubbles. And the child was immediately like, come here. And they done some practice. And then she immediately zooms the bubbles down to him, right? To make it fun and fast and show the child that when I do this, like this happens. You can also, I love using communicative temptations in social sensory routines. So songs and games. This is a picture of a family doing the row, row, row your boat motions back and forth. And you can, if a child likes this, you can kind of row, row, row your, right? And you're tempting that requesting to continue or sharing interest with you, and you can then keep going in the song. So that dramatic pausing, believe it or not, is really building some of that social reciprocity and communication skills. So these are the resources that I'm including, and this Interacting with Autism website has some good video examples. It specifically has an example of ESDM, or Early Start Denver model, that's pretty nice, and it's good for parents to see what that looks like and how you embed practice within play. And then this is a video-based, it's all video-based series of little trainings offered by Vanderbilt. You have to create a login, but it's free and you don't get any spam. I know because I have one, and there are lots of other there's lots of NDBI strategies in it. So you might search that system as a provider for some of these core strategies that I listed, right? Following the child's lead, modeling language, teaching a new skill. Like those are all kind of chunked at the skill level for you or for families if you want them to get some video experience. And then just for time's sake, I hope that I've met my learning objectives with you and shared some of the behavioral and developmental active ingredients that are really important for encouraging social communication, and that you do some of these things already in your practice and could add a few others. And I'll just go ahead and thank you all. And I forgot to put my email in here, but I'll put it in the chat if anyone has questions. And I'm happy to stay a few extra minutes if others have questions. in addition.
Thank you so much, Dr. Edmunds. That was such a wonderful discussion. Playroom 1 reminded me of the mess that's waiting up in my dining room to clean up later with my kids.
I mean, there's nothing wrong with that, but for an NDBI session, like
Sure,
it could be, yeah,
it
exactly.
does create
Right.
some distractions, yes. I think we all got a lot out of this session. If you can stay on for a few more minutes, and if anybody has any questions to send through, that's great. We have a question in the Q&A that says play therapy and PCIT are more available as treatment options. Can there be a push to have the therapist get certified in NDBI so they can use some of these skills when they recognize autistic symptoms, so as to increase their use even before diagnosis? Now, I don't think you are in charge of deciding whether there should be a push or not, but are there any efforts that you're sort of aware of to that end that people might want to be tapped into?
Yes, definitely. So with first of all, so far there isn't a certification in NDBIs overall. There are certifications in those packages. And those have pros and cons, right? Because they're expensive and time consuming. But I do think we could together like come up with, you know, like through BabyNet or others, like kind of a strategies based training or potentially certification, or explore a particular package that might work. PCIT is a fantastic example. It's a parent training model that's already building parent-child relationship, so that rich, engaged setting. And there is work that Dr. Laura Carpenter, I believe, at MUSC, as well as researchers at the University of Miami are doing to, I believe, embed specific strategies into PCIT, like add a few extra that are specifically strategies like this that improve social communication, just to kind of enhance PCIT. And then play therapy, I think play therapists are great at some of the really just developmental strategies. And I think adding a little additional, not a little, but like some additional support on how to create, number 8 here, these direct, and number 7, these direct teaching strategies. So just how to set up the play a little bit more so that you can kind of structure some and encourage some skill development. I haven't thought about that, but I think it would be very great to do something like that, especially if play therapists were interested in enhancing their practice with the direct teaching or behavioral strategies so that they become more like NDBI therapists. Yeah.
I think that's a super helpful response. And I think that you sort of answered Barbara's question from earlier in the session at the same time, right?
Yes.
The question was about, you know, because these are quote unquote name brand packages, do folks just sort of stick with one, or do they sort of mix and match? And I think what we're hearing is that if you're certified in one of them, that's essentially what you're going to use.
Yeah.
Competencies that you've identified are overarching for those
Yes.
who aren't ready for a certification to start incorporating the practices.
Yes, exactly. And I think there's definitely larger debate in the field about whether certification is necessary. I know some systems really require it, but it's also a barrier to implementation sometimes. And I think also, you know, there's more and more research trying to break down these strategies and figure out whether there's like a minimum number of strategies that need to be done, or if, you know, in reality, I think a lot of people are using some, but not all of these strategies in their work. And I so respect the fact that we know these interventions work because of studies on the packages. And I don't want to just break it all down into strategies without being cautious, but I actually think that we can encourage clinicians to add these strategies to what they're already doing right now, because we know it won't hurt and will probably help. And we can continue research on breaking down these strategies kind of one by one and seeing, you know, if there's like just continuing to think about how we can best implement NDBIs in settings.
Great. I think that got through all the questions that we had. I know there's been some ongoing conversation in the chat, and that we'll get an archived copy of that so you can look through the comments as well. But thank you everybody for being here today. Thank you, of course, for the work that you do every day with families and children. And thank you, Dr. Edmunds, for sharing your expertise with all of us today and your acting ability.
Thank you so much. And thank you to all of you for coming and being engaged and listening. And if any of you have feedback or questions or ideas for things we can do in South Carolina along this line, I am very, very open and excited to hear what you might have to say.